Okay, so we'll start this meeting. I know that let's see, that Bill couldn't make it in, but we can proceed. That we have enough people to at least start the discussion.
I mean, this is a incredible amount of research and very greatly appreciated. I'm wondering, Mr. Chair, if either Representative Shapiro,
Madam Chair.
bad habits. I'm wondering if either Representative Shapiro or Ms. Dyer could maybe go through some of the details of it.
And how it applies.
And how it applies to retention, which was the concern of the original bill.
Well, we retained it. Oh, okay. I'm trying to figure out.
No, sorry, workforce retention.
Oh, yeah. Can you help us out?
Sure. I was just gonna mention, just reading through, I mean, on page 3, and Christina can walk us through probably. She's much more familiar. I just took my notes. No. Looks like retention begins kind of on page 3.
Of the plan?
Just page 3 of the whole. Which part? Oh, I see. So of the, right after this notice from the department, it's this page here. It just talks about, providers report high levels of stress, adverse effects on mental health, insufficient educational opportunities, threatening the quality of care, and loss of staff to higher paying jobs that do not require post-secondary degrees, certifications, or further education. And just walking back a little bit, it just talks about how that's also limiting the number of, children that they can take on, of course. But that's the only point on that I've seen so far, but I'm sure there's more.
That particular area that you're referring to came out of Senate Bill 446. So this was in 2022, and then they created the strengthening plan, and they've received different types of funding to move forward with initiating that plan. In specifically the retention piece, if you look at the chart that is on page 3, the program initiative is the second one down, and they've contracted with Public Consulting Group, and the purpose is right there, a pilot program to study and assess effective strategies for staff recruitment and retention. And it just gives a high-level overview. If you're interested, I can also forward you the RFP so you get a greater idea of what the contract looks like. But they're really in the beginning stages. I would also say the other thing that makes this sort of complicated is if you go to the very bottom of the program initiative where it says Granite Steps for Quality, that was the separate memo that I sent you, which I provided to the Special Committee on Childcare.
Where's that again? That's
The Granite Steps for Quality.
yeah, in the packet.
It's in the chart.
At the beginning. Page 3.
Yeah, the program initiative at the very last option, which would be page 4, is the Granite Steps for Quality. And that is something that's been in the works for some time. I don't know if you're familiar with it was Licensed Plus and Licensed, and those are their credentialing to allow providers to get assistance, federal dollars. It's on the very last, it's on page 4 at the bottom of the program initiative.
Page 4 of the
The chart.
Page 4 of the chart.
Well, it is technically page 4 of the packet.
Where it says SB 170 FN?
No, that's before that.
Oh,
So I put a chart in here to put down some of the more, the program initiatives, and that one's only, it's a front and back.
We don't see that. Do you see it?
Oh, here it is.
Yes.
It's at the beginning.
Oh.
So go to the beginning, it's just the back of the second
Oh,
page
see it.
at the bottom.
Okay. Oh, Granite Steps for Quality, okay.
So that program's been around for, well, a long time. It just has a different name. And in particular, that program is addressing, using funds to improve quality. And so they're expanding this, and the idea is to provide incentive to providers to access quality, which is a different bucket, so to speak. So yeah, go ahead.
So I was talking to Representative Barry about the Committee on Child Care, and he was saying that I'm wondering if this is what he was talking about. So there are continuing education scholarships. Is that what this would be for, like for staff that they have, for the professionals to go and just, keep.
Yes,
learning more?
that is enrolled, but the thing with this particular program is that you have to be enrolled in Granite Steps for Quality, and it's not required, it is optional, but it is provided. But on the other hand, I believe that the Child Care Bureau also has to make this accessible in other ways. So I think it's concurrent.
Okay.
So the availability is required regardless of whether they're enrolled in this program or not.
So the intention of this program, is it to improve the overall quality, or does it, because it says capacity building project. So does it have a building and a workforce retention component to it? Or is it just basically focusing on quality control within the system?
So I would say, just because I'm not really able to testify or give any sort of analysis,
Yeah.
just based on my position as a nonpartisan researcher, but I do have people who could come in and speak with you if you wanted to, because I know several people that have been working with Special Committee on Child Care could answer those questions. I'm just, in my current role, I'm not able to do that.
Okay.
Thank you for that.
Could I ask you to clarify something else, if
Sure.
you can do that without being for or against? On the next page, which is labeled number 2, but it's the third page of charts. On the bottom, it says, I guess it refers to a statute, 79-534. And that says, it talks about a $15 million appropriation for childcare programs. I think it does. Maybe you can tell me if I'm right or wrong. For the purpose of financing recruitment and retention bonus and benefit grants for New Hampshire child care employers. Is that what it says? Is that actually what it is? And does that have an overlap with the bill that we're considering? Because the bill that we're considering was specifically about retention and recruitment subsidies.
So I can't answer that question. I can tell you that this was an HB2, and I might direct you to
That was my question.
the DHHS status report, which may be helpful, but otherwise I can't comment on that.
Okay.
So, from what I see, we've budgeted money for this exact thing that this bill is for. It went through in the budget, and there's substantial millions of dollars of federal relief that's gone to providers. 87% was to the providers. We've received 142 million. 43,000 since 2020, it seems. So I think I don't see this bill as necessary with all the other things going on and all these other programs that are already in place. Personally.
I tend to concur. this is a staggering amount of research, and it's very eye-opening, and I think speaks to the seriousness with which the issue is already being taken, and there's substantial legislation and big chunks of HB2 and lots of federal dollars being committed. So I think the legislation that we had in 566, which is looking at, I thought there was a $1,000 sign-on bonus and a $3,000 retention bonus after 5 years. I think is kind of too little, too late. I think the focus really should be in what we have here. Is my thought.
Yeah. So I think I probably, in the long run, would agree with both of you that these are overlapping efforts, and the actual bill was a rather small effort compared to the amounts of money and all the different things that are being proposed. I guess it's hard for me to know that for sure, because this is kind of outside of my wheelhouse. And so like looking at all this stuff and trying to absorb it is new for me. And my questions are, number one, is the bill that we're here to consider today an ongoing, would provide ongoing relief? And are all these efforts federal monies that will go away after the expenditure of COVID funds? So that's one question. And the other question is, how much of these funds are going to pay consultants to develop a plan versus actually going to the daycare providers to provide bonuses for retention and recruitment? I'm not saying that means that we should pass this bill. I'm just saying I don't really fully understand those issues. So, for example, just give you one example. The thing that Ms. Dyer talked about initially, childcare, workforce recruitment and retention on the first page. The contractor is Public Consulting Group, whoever they are, and they're going to get $1.5 million over 2 years to kind of to develop a pilot project. So that's different than money actually going to the daycare providers to provide bonuses and for recruitment and retention right now. So I'm not really disagreeing with you. I'm saying I can understand all the complexity of it enough to know that there's something else in here that's as concrete as the bill we're considering. Does that make I don't know if I'm being articulate.
No, I understand your concerns perfectly. Yeah.
I understand that, Joanna, and I agree with you on that point. There's a study going on. But the very next part of this chart is actually talking about $1.5 million being allocated over 2 years to support providers and partners through the Granite United Way. So there is money being given to providers to help them in the process of having been working for a community partners organization that provided daycare as well as Head Start services, and knowing they had challenges trying to find qualified people, like all education thing, having money available through some source to start off with, I think is a good thing, and it's not necessarily coming from the taxpayers. It's coming from another source. And I think the study work that needs to be done it will help us long-term determine what money needs to come from the state to help support those organizations to make sure they can continue their work, because that's the challenge. Is really, and part of it is I know those organizations were decimated with the COVID activities and trying to rebuild has been a long, slow road. So having these and having an incentive, it's now with money that is available, and then what can we do for the future is important.
Yeah, and on, oh, sorry.
I would just say, having chaired a couple of subcommittees, when I came into this subcommittee, I expected to see stakeholders here. Because every time I've chaired a subcommittee, and thank you, Madam Chair, for recognizing me, but every time I've chaired a subcommittee, it's been full of stakeholders, whether it was on PFAS or the Human Rights Commission. The fact that nobody is here and there was just full of stakeholders tells me that it implies to me that those concerns have been addressed. Before I would want to go forward with this, I would at the very least want to hear from them to say where they see those remaining gaps. Quite honestly, the fact that this is an empty room tells me that a lot has been done to address their concerns. Thank you, Madam Chair.
Joe?
Thank you. I would tend to agree with you. And even more so, I spoke to the prime sponsor of this bill, who pretty much said what you said. He said, well, you know, also without understanding all the details of all this stuff, he just said, Representative Germana said that, well, I just assume that that's not going to go any further because there's been so much done that's so much bigger and so much more significant in the amounts of money than what my bill initially talked about. So I don't think, so I know he doesn't have any expectation of this moving forward. And I guess I just wonder if we have to take a vote on this, I assume. So if we were to ITL it, is there some mechanism by which we could, formal or informal, that we could pass along our thoughts to the special committee on daycare, that all the efforts currently being brought forth are difficult to understand, and it is important for us, well, it's important for me, that among all the money going for planning and one-time monies, that there is, that we support an ongoing effort to create a program to support retention and recruitment. You know, a concrete program, not one that's paying consultants to come up with a plan. So, you know, I would be okay with whatever we would do, ITL, I guess, recommend ITL. As long as we were able to pass that along to that special committee, that this is an important issue to us, and it's hard to know to what degree it's concretely being covered by other efforts.
So I think at this moment, I could look for a motion.
Madam Chair, just,
Yeah.
it's been a while, so do we take a vote here, or do we take it back to the full committee?
You can make a vote, you can take a vote anytime between now and the executive session.
Okay, and that would just be a subcommittee recommendation, and then,
But yeah, the way I understand it is we would vote on, based on what the knowledge that we have read and considered, we can take a motion, and then, whatever we decide to do, that information will be passed on to the committee.
I move that we recommend ITL.
Second?
I'll second that.
Okay. All in favor? Aye. Thank you all.
Before we close,
Go ahead.
just like on the, I just want to speak a little bit to this.
Go right
I think
ahead.
there is.
Yeah.
There are some concrete initiatives in here, and your concern was longevity. And it looks, I just wanted to point out that it looks like there is, they're looking at this long term. And there's 3 phases to this, the ARPA plan. And they're just starting phase 3. And that's all about long-term stabilization, so we can feel a little better about our vote to lay this one to rest and let, you know, that there are significant investments going into this.
I would agree. I'm just going to pass along, I'm going to put a comment in this that we need to make sure that the child care committee that's monitoring this stuff needs to continue to monitor. And if we need to enact legislation at a future point, that's something that we can bring back to a committee. With that, I think we're closed and we'll have resolved this.
I would just like to thank Ms. Dyer for doing all this work, and while we might not fully understand it, at least we had it to try to understand it and to understand it in the future.
And it's something that we can bring back to the full committee as well.
Yes. And I appreciate your work. Thank you very much. And I appreciate all of you for providing your input as well. I think it's a good thing we've done here, and we can pass this along and know that we've addressed the concerns that the committee had raised. Thank you.
One retained bill committee.
That is the shortest retained bill subcommittee
Question, given that this was for the most part a foregone conclusion, is there any way that we could have done this without actually having met, if we had somehow?
No, if it's named, if your name's up, then you have to meet.
So we had to meet to do this, even if we all felt the same way before we got here.
Yes.
But we don't have to meet again and again.
No,
and again.
that's right. And, you know, even if you didn't agree, you could have met with me before the executive session and voted that, like, it doesn't.
It's also still good to bring the conversation and the rationale
Right.
to why we feel, you know, to the public.
Have a nice rest of the day.
Thank you. But
Thank you.
And that's,
you two have other committees today?
no,
No,
do you?
No. I wish we could have coordinated this.
This-
Yeah, it seems everything's.
On a previous committee, there was only two of us, so we couldn't do much of anything, but Christina was with us, and she made